Hello, good afternoon, good morning, everybody. My name is Stephen Flanagan. I will be leading this presentation on provider administration and going a little bit beyond the basics. We do have a number of people registered today, so if you have any questions, please do use the question panel or the chat in that GoToMeeting window that should be popped up on the right-hand side of your screen. As I see a question pop up, I should be able to stop and answer those questions immediately. So you can type out your question, you can just type out a question mark, and I should get an alert so I can stop and answer those questions as we go. For those of you that are just joining, basically today what we're going to be looking at is the admin side of Therap. And I know just about everybody on here has admin capabilities. So what we're going to look at, instead of just looking at how to add users and individuals and how to add caseloads, is going down that admin screen, looking at some of the things that don't necessarily get covered in your initial administrator training, or you may have not received that training in a long, long time, and you have new administrators. So just kind of a walkthrough of all the admin functionality that we have that is specific to provider administration and what you can do in the system, assigning privileges, adjusting preferences, setting up two-factor authorization, all of those fun little tools that you have and what they can do. So again, as you have questions, I will be on the lookout for anyone who is asking a question or talking in the chat. You could just put in a quick question mark and I can unmute you, so you don't have to type in a whole paragraph if you just want to ask it that way. We should have another Therap attendee on as well. I think they may be having some login problems, so they will be able to assist with the chat as well. So just a quick confirmation, can you guys see my screen and hear me fine? Hey, look at that. We've got questions and chat. Cool. Thank you very much. All right, so let's go ahead and log in. Like I said, we are going to be just running off the admin tab today. So if you have to step away for any purpose, this is being recorded. We will get this up. Usually we get these up in about a week. I think we're about 2 weeks behind on loading some of these older webinars. So this will be up later next week, the week after at the latest. So if you have to step away, this is going to be publicly posted. You can come back and check out this stuff if need be, or to share with your colleagues and new provider administrators as they are promoted. All right, so we're logging into an account here, and we're going to be looking at this page just about all day in some form or another. We'll be clicking through these. And I think we'll just take this from the top and run through this list. So if anyone has questions as things pop up, we can go back and address those. But feel free to interrupt me as we go. So let's start with the top, the provider preferences. A lot of your provider preferences are set when you first set up your account, but there's a few things that you may need to adjust and get back in here in effect as you are opening up new modules and have access to new things, or you're using modules in a more detailed way than maybe you had originally envisioned. So you have things on provider preferences like how long do you want the screen to stay on if someone is away from the keyboard, not paying attention, not doing something in Therap, not typing anything. How long do you want the screen to stay and that person stay logged into Therap before they have a timeout? So this is going to be a very high number if you have a large number of case managers or care coordinators or number of staff who might be on the phone quite a lot and might be multitasking on the computer. If you're a large agency with a lot of direct support professionals, maybe you want a lower number because you have a lot of shared computers and you have a lot of instances where people walk away from the computer. So we give you a window between 15 to 60 minutes before the system will automatically time out. Provider logos, you have 3 sizes. Once you start printing off things in PDFs, you can adjust that size. Your calendar preference for things like electronic visit verification and your scheduling and your billing modules, your days of the week can start on particular dates so that they match your external tracking. When it comes to T-logs, a lot of you guys will start using T-logs. We almost always start new customers with T-logs because they're really hard to, they're not structured. They're basic narratives. And we give you a couple of options that you can set for your agency. One of these is the ability to create T-logs without actually selecting an individual. And that's basically your facility-based note about that particular site. So you could create a particular facility-based note about your Oak Ridge Day Service site. But everyone who has access to any of the individuals and to Oak Ridge Day Service is going to be able to see that T-log. It's not individual related, it's not program related. It's basically if you're writing T-logs about that facility, people are going to be able to see those notes about those facilities. So keep that in mind. There's no caseload in Therap that is restricting, saying, hey, you can't see this particular T-log because you don't have access to Tim's notes. It has nothing to do with Tim. You didn't select him. So people who will see Oak Ridge are going to be able to see all of those T-logs. And then we also have enable time in and time out about a T-log, making it a little more than just a narrative. You can also have a begin time and an end time. And in that way, some agencies are using a T-log as a simple billable note. Case note templates, if you're using the case note module, which is great for your service coordinators, care coordinators, case managers, nurses, clinicians to write their specific clinical notes or questionnaires. You can select multiple types of templates. Your staff do not generally run into this issue, but you as an administrator do, and that is these boxes with the scrolling bar. If you click on anything, clicking on another thing unclicks it. So keep in mind, hold the control key when you click, and you can select more than one thing in that box. So as long as that control key is held, I can select more than one thing. Simple browser-based issue. It's not the most intuitive thing, so I'll tell you now. Again, your staff tend to not run into this issue on the modules that they use because most things have them select only one item in a list. You guys have access to these lists that allow you to select multiple items. So you'll see these kind of drop downs, and it is nearly always the case where you have a scrolling item. You can select more than one item by holding the control key. You can also select default templates so that if most of the services you provide are a particular type of clinical service and your case managers are writing about that, then you can select whatever that default case note might be. For GER preferences, there's a couple of places where you are affecting your general event reports preferences. One of them is here in provider preferences. There is also a separate tool that we've added to the admin page for your general event report preferences. And all this does is kind of force your staff's hand when they are saying a type of event happened. They're going to get an alert that says the following people need to be notified because you said this is a particular type of event. In this case, that type of event is something that they've labeled as a high notification or a medium notification. As well as anything where someone suspects abuse or neglect or exploitation, you can select the people who you would like to have contacted at the time of that event report. Now, the system is not going to force that direct support professional from going and contacting the, let's say, the medical examiner. Okay, it's not going to force the issue at the level of just submitting the GER. It will force the issue at the level of approving the GER. So when it comes to your desk as the provider administrator or the person who is managing your incident reports and approving those final versions, they're going to get an alert that says, hey, this is abuse or neglect. You were supposed to talk to, you know, maybe a family member or guardian might be more appropriate than the medical examiner. So it allows you to kind of customize to a small extent your high incidence, your medium incidence, and your exploitation, abuse, or neglect incidents, as well as a couple of modifications for whether or not you want as an agency to use witness reports. A lot of agencies opt out of using witness reports. We tend to advise agencies look into the witness reports before you turn them on automatically because they tend to slow that process and they tend to be not utilized unless you are very particular about training your staff on when to include a witness and when not to include a witness. So they can be very troublesome unless they're done appropriately. And then finally, with incident reports or GERs, we use them, we have our own language, you guys all are aware, but you can link your behavior event records to those restraints that are related to a behavior, or emergency safety interventions that are related to a behavior. In Therap, on the general event report, they are listed as restraint related to behavior. But whatever physical intervention you are utilizing, upon completing that event, you are given the option of creating a behavior event record so that your clinical data can match what is being added in your general event reports. Okay, I'm not seeing any questions so far, so we're going to roll through a little bit of this. GER state interfacing preference. For a couple of states, we do have an external ID number for each agency, maybe a numeric number or an identifier. You can plug that in so that the incident reports also have that identifier for the agency. That may be different than the fact that you are, Home of Hope Services in North Carolina. Instead of just the agency name, you have the ID. Training management preferences are going to allow your users to sign up or cancel their signups. A lot of this is very self-explanatory, so if I'm running through something too fast, don't be afraid to ask a question if it doesn't make sense the way I'm explaining it. For your billing preferences, you can get notifications when you have X percentage of services left, or X number of days until those service authorizations expire. Very helpful when you're trying to manage lots of service authorizations expiring at different times and stay ahead of your billing. IB is there for individual budget. So for those of you that have an individual budget that follows the person and you're able to manage all their services and supports, when those individual budget service authorizations are going to expire, you can set an additional alert for those as well. We have a field for PDF preferences. As you're printing off, most forms in Therap will generate a PDF. There's a few exceptions, but most things in the system are going to generate either an Excel file, a PDF, or both. You can choose to have every form have that individual name, Medicaid name, date of birth, and social security number appear at the top of those PDFs. There is a College of Direct Support preference for those of you that work with your state or have purchased separately College of Direct Support for your staff training materials. This is just a bridge that allows them to click within their Therap account, and it will log them right into their College of Direct Support account. So there's a process built there, and we can review that with those of you who are interested in College of Direct Support. I think it might take too long for this particular provider admin session. For your individual support plans, the old version of Therap's ISP plan, not the individualized service plan, though that old version ISP plan can link between ISP programs and valued outcomes. Those of you in the state of New York, I know a couple of you, this was vital in years past. It's not necessarily as vital today. However, those of you that want to see that valued outcome associated with your programs that you're building for the ISP programs, you can build that connection, that link between those two, so that those two, that valued outcome is stated. And then your personal finance preferences, if you want to limit how many days you can add or update a transaction, I think the limit for this is 3,650 days, approximately 10 years. I think with leap years, it's just a little bit shy of the 10-year mark. But you can set a limit so that no accounts are created and non-activated within that time period. Or if you create something and don't activate it, then it will archive and not be available. You won't be able to make any changes to it after that time period. I would say set this to the maximum number possible right now until you have a clear footing of what you're doing with personal finance. You tend to run into some issues when you're trying to clean that up later otherwise. And we do have a place for your footers, for your letterhead, so you can upload a header, you can upload a footer, so that every nice, Therap doc that you are putting on your agency's letterhead is going to have that logo and nice letterhead attached to it. Billing restriction for ISP data and case notes. You don't want old data to be billed because you're not able to show that it's contemporaneous and you're worried about recoupments. In this case, you can set a restriction so that no old data can actually be billed. You'll get an alert when you're trying to bill for it, in which case you can go and manually review that data and say, okay, that's okay. I want to go ahead and clarify this and change that date to allow this exception, then you could do that. Come back in, change it, and then turn it back to your settings so that your billing department is still very clear and not taking any data within 7 days or 14 days or whatever the ascribed time frame is. Finally, two-factor authentication. Therap's one of its latest security measures when logging in to identify and verify that the person is who they say they are. You can enable a one-time password to be sent for a person's email. So you will go in and individually force two-factor authentication to users within Therap, and they will get a note on Therap when they go to log in that says you have to enter your email, and they will enter their email. And then the next time they log in, they will get an alert, a little pop-up orange box that will say, you know, please check your email for the two-factor authentication code that was sent. And they get a 5-minute window to go in and enter that code, verify they are who they say they are because they have access to that secondary email, and then they continue happily going about in Therap as they want to. Any questions on provider preferences? It's a quiet group, so I know I'm telling you guys all information that you already know, but hopefully for new people that are doing provider administration, there's some useful information and tips in here. Password policy, nothing really too specific about password policies. It's all very, very clear, the minimum length of passwords and digits and uppercase letters and all of that information. Note that you do have a differentiation between the dates and the number of days for expiration for regular users versus your super admins. Now, super admins and Therap have a lot of those extra capabilities, the ability to contact Therap and say, I need this password reset, or I need this account activated or something. As a super administrator, we know you are someone that is working for the agency. That's not something that, you know, John Q Manager can inadvertently give themselves access to. It's something that needs to be set up from another super administrator. So there are a few people in your organization that are probably going to have access as super administrator, and some of those people, being presidents or CEOs or executives, may not be in Therap as often as you guys as provider administrators. So we have this differentiated date so that you can send a longer warning for those super admins, since maybe they're only logging in once a week. And you want for your regular users to have a much shorter time frame for letting them know when their password is going to expire. So hopefully that makes sense. I am going to skip over most of this information about users. Everyone here who is an administrator has probably added a Therap user into the system. You've added an individual or person who receives services. You've created titles. You've changed someone's password. You've added roles and caseloads. You've done the basics to get them into the system. That's part of the regular provider admin or training. So I'm going to skip some of this stuff. If you have questions, let me know. I will stop to answer a couple of things on the user list though that shows up. This option, search imported Excel. When you're adding your users, you can add them one by one. You can import them as an Excel spreadsheet on a one-time basis. Multiple times you can import new users into the system. Once you've imported those users to the system, you may want to go back and see which ones took, which ones didn't take, what error messages you may have received, in which case you can do a search for the imported Excel file that you completed. And I don't think I have a completed Excel file in here, so I'm just going to cheat and take you to our support page that tells you a little bit about that search for imported Excel. Now, when you go to look up that file that you did the import of, it's going to show you that file. It will also show you for that file a place for a detailed report that you can generate. And that detailed report will give you the results message that's going to tell you if someone wasn't imported or if there was an issue. It will tell you that you had an error with this particular login name. You had an error because this person already existed, or they have the same user ID, employee ID. So it will give you reasons why your import didn't take and your numbers don't match. So you guys are all using the system. You're all very comfortable with it. if you're taking on a couple new houses or something, or new sites or facilities, as your agencies expand and you do a mass import and the other agency is not using Therap, or they are using Therap and you just want to export that data and import it into your Therap account, you could do that and then look to see if there's any kind of sort of like, individuals that exist in both. So little tools here and there that you definitely don't use often, and we don't spend too much time talking to you about when you are first training as an admin. All right, two-factor authentication. Now for this, you get your user list of everyone in the agency. There's no easy way to go about doing this. You have to go down and you can force any individual to have to go through that two-factor authentication process. So as I force Andrew, the next time Andrew logs in, he will get a pop-up message that wants him to put in his email address as his second factor that the system wants to verify that Andrew is Andrew. So you'll do that. Then you'll have Andrew go in and plug in his email address. He'll play around in Therap, he'll log out. Then he'll come back in another day or later on in his shift, and he will get that orange pop-up that will say, hey, Andrew, it's time for you to use this second factor authentication to prove who you are. And he has to then go to his email and see what message was sent from Therap authorization, type in, I think it's like an 8-digit code, and he's then good to go. He can continue using that device. And I think there's a little checkbox that he can remember that device so that it's not going to always send a two-factor authentication. And I think that's good for about 30 days. So it keeps your secure browsing within Therap and your secure access that much more secure. And it is a requirement in certain states, whether for EDV or for utilizing an EHR. Self-password reset in a similar vein. Going through this, it's the same process. You can enable a self-password reset for somebody. It's the alternative to a two-factor authentication. So someone who gets locked out, if you enable a self-password reset, they're going to be able to reset their password through a token that they will receive for a temporary amount of time to reset their password if they're locked out. All right, moving down the list, you have physicians. We have a question. Liz asked if they're planning on having the two-factor authentication and self-password reset enabled choice when setting up a new user. Right now you have to, yes, good question. Right now you have to remember to do this after they're already added. It's not an option to do it as you're entering in a new user. That's something we are most likely going to address with a future update. I don't have a release time for you, but I have seen people talk about that. I think we talked about it a little bit in a session at the national conference. Because this was built after the fact, we didn't go back and address that adding a user process. So it's a little bit cumbersome. When we add these new features, I think we make them a little bit cumbersome adding that process after, and then we work on building it in afterwards. So short answer was yes, but I don't have a time scale for that. As two-factor authentication becomes more and more a requirement with EDV and stuff like that, then we get more and more requests from users, and this becomes a much bigger priority. I know right now it is a task to go in and remember that everyone has to have the second process. Yes. All right, moving down the line, we have physicians information. Any user in your Therap system could be a physician. We encourage you to give access to as many Therap users as you need to have. Therap is not billed by the number of users. We come from the perspective of the more people that have access to a person's data within their circle of support, the better the better the system is, the better their care is and everything. So if you want to add a physician and they're a user, you can turn them into a physician within Therap by going through a list of all of your users. And then if I'm taking a look at Benita here, and if she's a physician, I can go in and add her license number, add her MPI number, her UPIN, her DA, those qualifiers, for auditing purposes. You need that physician's information in the system, especially with health information exchanges. I can add them to that user, and then Benita would have authorizations as a physician to do physician's tasks. So there's a Health Plus module that has things like doctor's orders and stuff where you can enter orders. And there's additional features that I don't think we have completely rolled out yet. We've looked at and talked about things like e-scribing. I don't know where the team is with that one in particular, but that would play a role with something like a physician's information. So I don't want to give you guys information about stuff we haven't released or don't plan on in the near future. It's just something that we've been, that's constant aside discussion. All right, changing passwords, nothing new here. I think everyone has changed lots and lots of passwords in their time. Just as a reminder, where we put these colorful notes at the top, pay attention to those. They are trying to make things easier for you because there's things that you will forget about or not realize. It's easy to go in and deactivate somebody, but when you deactivate them, you lose all of their privileges and caseloads and profiles. So if you plan to go back and reactivate them after an investigation, after administrative leave, it might be easier just to lock that person's account rather than to deactivate them. Now with a locked account, you still have that person active in the system. They still show up in SCOM lists. They still show up in places. They're an active user. So there are downsides to having someone active but not accessing the system. So you want to think about those when you're making the decision whether to deactivate or not. But keep in mind, when you deactivate, if you plan to reactivate, you'll have to redo those privileges again. And that's a little bit of a time waste on your account. There's no easy way to reactivate old privileges. All right, going down the list, we come down to user privileges. I think we're all familiar with managing and adding user privileges, assigning roles and caseloads to each person, and assigning admin roles. However, we tend not to talk about the archive process. So just as a quick review, anytime you go and you make a change to someone's user roles, your activity tracking isn't necessarily capturing all of that information as far as what privileges and roles were taken away and removed and what someone had the ability to do at a certain time and place when their roles were different within Therap. As those roles and privileges and caseloads get changed over time, and as you're tinkering in the background with the admin privileges, you're creating an ongoing record, even if it's not searchable in the activities, in the activity tracking. And a lot of that record is searchable through archives. Now, when you're in the archives, you can go back and search over a year's time. So if I just go back to, let's see, August 28, 2018, and just leave the rest of the field blank, I will have all changes done to any user's privileges over that time period. And you can see if I just take a look at my privileges that were done at that time, I see all of the agency-wide roles that I had, the profiles that I had in place, and I can click on those roles to see what was involved with program director or who was involved, who was included in those particular caseloads. So sometimes you have to go and you have to solve a riddle of who saw what when because their roles have changed or they've had additional access added or taken away, and you have to solve, were they able to do that at that time and place? Go into archive to find what their privileges were at that time and place, and you will become a super sleuth within Therap. So that's basically the additional features with that archive. We also have this legacy archive, which is less flexible. We didn't really install this feature and start doing a lot of this stuff in the background of administrative tracking until anyone wanted to take a wild guess of when that date took place? If you guessed July 2010, you were so close. July 2011, we instituted those features. So you have a legacy archive of all those changes that were taking place up until July 2011, at which time all changes go into archive, and that system is much more flexible. You can click around and see the user privileges, you can see the caseloads, and you can see what administrative roles they had. So you will see this legacy archive term kind of pop up, and that generally means you get to see something, but you don't get to click around and see too much of the details. You just get to see as much information as we kind of had in the background to show. as we're realizing people have questions and are putting more and more information in place, the system gets updated and changes, and you get a more fully robust activity tracking and an archive system and the ability to go back and see that stuff in time. I don't think there's anything too different in admin roles. I think when you're setting this up, we usually tell you to go and see who has access to which admin roles. Unfortunately, this list does not export to Excel. That's been a long-standing request, but we do have a report library that will give you access to this same information. So if you don't see that in your report library, just request it from us. You can run this report. It's an exportable to Excel report, so you can look across your agency and see everyone who has the ability to create custom user groups or do password reset or whatever it is you're looking for in your account. Moving on to splash messages. Looks like we have a hand raised. Tara, I'm going to go ahead and unmute you. If this is by accident, just let me know. But Tara, you're unmuted. You had your hand raised.
Yeah, just a question as to how would I know if I have that report?
You would go to your agency reports and do a quick search in your report library for, I believe you can look up the word admin, either as report description or report name. And if it doesn't show up, you need to make a request. This is a demo account, so we don't have them showing up. And if you don't have that showing up, go into feedback and send us a request. We fulfill these provider or these report library requests by super admins or provider admins as they're coming in.
Okay.
All right. Was there another question? Okay. Oh, and just a heads up, you want to check out what is in your report library. If you go to, I think there is a page on the support site about report library and what reports are getting updated. There's about 120 or so standard reports that everybody gets, and then there's reports that we build for customers as they request, and then we turn those into standardized reports, but we don't automatically import them into your library. So that's one of the things that you can look into or look and request and see, you know, I don't have any reports about admin functionality. I need that, and then you can send in that request. Okay, it looks like we have a question. What's the name of the report I just spoke of? I don't know that report offhand. I think I don't know if it's the admin role report or all roles, including admin. I will have to follow up with you guys on that. When this gets posted, I will hopefully have an answer for you so that you have the name of that report. Okay. Moving further down the list, you have splash messages and you have sign-up agreements. And I know we kind of go into a little bit of detail when walking through some of this stuff first time with you about setting up splash messages. Splash messages are non-official messages. You want people to see things when they log into their accounts, and you can set up splash messages. So if I go and just take a look at the splash messages that we have in the system, I'll leave these fields blank, and I think we only have one. So you see a message that all users who log into this account are going to see at least once. Now they'll have the option to say, don't show me this message again, or they can ignore it and it will keep showing up for a designated period of time. But the important thing to note with these splash page messages is that you can insert those images into the splash page message. So if you wanted to communicate something with your staff about something, if you had a agency-wide fundraiser, if you you know, wanted to talk to people about something for them to look at in their W-2s and communicate with everybody, the splash page message is an easy way to do that. And we have very simple, you guys are all familiar with the word font list. We don't necessarily have a great list of different text options here for fonts, but we do have the ability to go in and do subtext and superscripts to, you know, kind of adjust some of that text as you go. And you can set up an expiration for these splash messages, so they're not going to show up after that particular date, even if someone doesn't check, do not show me this the next time I log in. once they check that splash page message is hidden, they're not going to see it again. So again, because they are unofficial, they can easily check, don't show me this again, and there's no acknowledgement of it. We don't tend to recommend that these be used for really official purposes where you need acknowledgement and an audit trail. They're used for, I would still say official purposes. You don't want to say that we have like a, I'm selling Girl Scout cookies here, and, if you guys help me out, I'll be the best boss you ever had. But you're not going to get the audit trail on this as you will on the sign-up agreement. So you want to make sure you make the distinguishment between splash messages and your sign-up agreements. And your sign-up agreements are much more simplistic. If I take a look at this particular traditional care policy, I can update this and create a sign-up agreement. All you have is the title, the details, just text, no font manipulation, no images, no anything else. And then you can say what type of sign-up agreement this is, something that will show up the first time that user logs in again, they have to acknowledge this, or every time they log in, they have to acknowledge this brief statement that you want them to agree to. You can have multiple sign-up agreements, you can have multiple splash page messages up and running at the same time. Sign-up agreements do not expire. They only leave the page by the person agreeing to the terms of that sign-up agreement. All right, moving down to activity tracking. Now, I said before about archive with our activity tracking. Activity tracking doesn't capture much of what's being done on the provider administrator end of things. It captures what's being done in the modules. And as new modules and new functionalities being added, we go back and try to make sure that everything is added to this activity tracking as well. Every once in a while, something is missed for a period of time. We have to go back and add that functionality to it because we've enabled an acknowledgement on the form, and we don't have to acknowledge something until that gets addressed. Mary had a question about sign-up agreements could be and should be used. So just a quick repeat of that before we get into activity tracking. Your sign-up agreements are things that you want staff to sign. They have to acknowledge before they can go in and do their work in Therap. So with a sign-up agreement, you can set it to one of two types. The first type is the first time someone logs in, they're going to be forced to agree to that sign up message. They agree to it and they can continue working in Therap. They click disagree and they're signed out. They can't get in to do their work. So it's basically a wall that restricts them from going any further until they acknowledge the thing that you want them to acknowledge. The other type is the type that every time they log in, they have to acknowledge a message. So a lot of agencies might have something like an electronic use policy or a standard for reporting HIPAA, or about the importance of protected health information or abuse and neglect. You might have something that every time someone logs in, they have to read 2 or 3 sentences about, providing the best care and reporting when something is wrong or they think someone is being, exploited, abused, or neglected. Maybe that's a standard operating procedure, abuse, neglect, exploitation statement that your staff sign off every time they log into Therap. And then you have a sign-up agreement that you can look and see that they signed that agreement 476 times over this last quarter, and yet they still were, charged with a exploitation charge in your investigation. So that's the sign-up agreement. And then the splash page messages, because you don't have an audit trail to go in and see how many times someone has viewed that splash page message, and because the user has the ability to check off a little box in the lower corner that says, nope, I don't want to see this anymore, don't show me this message again, there's no audit trail. That splash page message is just going to show up for the period of time that you want it to show up, or the user says, I don't want to see this again. So we encourage splash page messages to not be things that you would use to train your staff or to communicate with your staff for official purposes that relate to their job. Whereas a sign-up agreement, you could utilize that because you have the audit trail, you have the agreement acknowledgement signatures. All right, moving on to activity tracking. So I mentioned that provider administrator was not utilized or is sparingly shows up as far as your audit trail that shows up in activity tracking. This tracks what's done in the modules. And looking through the things that you can look at, like specific programs, specific users, specific person by their login name, a specific site, a date, time frame. If you leave fields blank, I think you can look up to a month's time with all the other fields blank. Some of the things that are missing here, though, you can't look up something by a person's role. So you can't look up an action that a particular person who has a super role, like all of your auditors with the title of auditor or the super role of auditor did. You're not able to kind of look up those activities by a type. It's not a feature that we have enabled. We've gotten requests, but we don't have that feature enabled. You can look up things by specific time and module. So if I take this back, just look over the past. I don't want to take that too far back because I'll get an error. So we'll look in the past month for any action that took place in a GER. In this case, I don't want to do a general event resolution, just a general event report. And I can look up specific actions. So the list of actions is going to depend on what module I select. So if you do personal finance, there's no state incident report submit. There's no removing file. There's no approving or reviewing that takes place in the personal finance module. So this conforms to the module that you have selected. And likewise, your activity type also has to do with what module and action you've selected. So you're kind of drilling down into the activity. So if I'm looking for anyone who has viewed an incident report in the last month, and this is an invalid format because I forgot my backslash there, and I want to see any types of activities, I can see if passwords expired, anything of any nature. Your activity type is linked to your user, general things that they can do. You know, getting locked out of their system, if their password had expired, if they did an incorrect login, all those sorts of things. So in doing that search, I'm going to get reports that has anyone that has viewed any incident report. And the first thing that you notice outside of it being you know, a basic Excel spreadsheet that you can spread, one of the first things you notice is that there's no specific individual identifiers on this form. This itself is a HIPAA protected search. You can see the form ID, which has the official ID number that you can go back and plug in for that particular form. If I went to general event report search and plug this in, I will see who this general event report is that Rich viewed earlier today at 11:38. I do have individual form ID, so this is someone's individual data. So I can plug in that number and look up which individual has that number, so I can see that these were all the same individual that were viewed, and I can see who that individual is. It's additional work on your end to have to do this, and I don't know of an easier workaround than to use the individual form ID or the individual data ID to kind of identify those on a script. Some providers, because you know this information is kind of already in the system, they will export this to Excel and they will run a quick match to kind of match these IDF numbers to the person. So they'll do a find and replace. So once they run that, this information is already in the system, and then they can identify this data and look at it in Excel freely. We just don't do this on the activity tracking, and yeah, I do not know the complete rationale for this other than it was for HIPAA purposes as far as the totality of access and stuff are concerned. We strip the identifying details from that. All right, with caseloads, you guys have plugged away with programs and sites and created caseloads automatically through creating a site and adding individuals to that site. Now, every time you add a site, the system will automatically generate what's called a all program caseload, and that is all of the individuals who are enrolled in that particular program and site. The system will also generate something called an all individual caseload, and that is all the individuals who are active in your system will show up on that all individual caseload. So this is system generated. You cannot go in and make an edit. You cannot go in and make a change to these particular caseloads, but you can make changes to caseloads that you create custom. So if you have 5 people in a facility that is 200 people and those 5 people are on a caseload, you can create that custom caseload and it will be listed alphabetically after these APCs and AIC caseloads come into play. You can go back and edit the names if you want more of the naming mechanics to kind of follow a similar pattern. However, you cannot start any caseload with the word semicolon, semicolon, APC or AIC, because if Therap ever wants to turn around, or if you ever want to turn around and create a site that's named whatever you name it, if I want to create a site called, Day Program Z, and I went in and made a custom caseload that is, just 5 of the people in Day Program Z, this system will kick back with an error because it wants to create an all-person caseload of all the persons within Day Program Z. So names, caseloads, editable, but you have to come up with like a new mechanism if you want to change that. You're not going to be able to borrow that APC or that AIC to kind of put them earlier in the alphabetized list. All right, I don't know if there's any real, aside you guys know Archive and Legacy Archive now, so I don't know if there's anything new in Super Role to kind of look at. Any caseloads, any Super Roles, as you're looking forward, it's always a good idea to do some extent of spring cleaning or regular cleaning and take a look at who's assigned to particular roles, so that, let's say you have that auditor role that you were looking at, maybe we want to see if we still have any auditors assigned to that role because they came and they did their audit, and we want to kind of, turn that off now that they've left, and we don't want them looking at it outside of their window of time to look at our data. Those are just quick things that you can do to kind of look and see who has access to what. Now, we also have we also have that feature on caseloads and some other things. You can see who's assigned to which program, who's assigned to which caseload, who's assigned to what super role. So it's a good idea to kind of go through those and see who's assigned to what periodically. For your default notification profiles, you can set up for your agency a default set of notifications for people like nurses or case managers or quality assurance people, or anyone that you want notified of events when they happen. Let me go in and just create, we only have this one default notification profile for test. If I go to edit this or configure this, you'll see kind of how this works. Basically, I can go in and add a description instead of saying this is test. Let's say this is for nurses. We'll say for on-call nurses. And we'll call this on-call nurse. Very simple. And then I will go and configure this. Now, in configuring this, you're basically selecting one module at a time. And in the case of nurses, I'm interested in the MAR. So now the system is going to say, do you want your nurse to be notified every time a MAR is saved? They'd be getting text message or email alerts every time someone goes and notes that they've delivered a medication. They will be ignoring their phone and ready to quit within 2 days. But maybe you do want them to get a notification of when a MAR gets locked because there's a new medication and they have to go and review that MAR. So this might be something that they find useful. And you can set up that default notification, and then they can apply that default notification to themselves anytime a MAR is locked. And then they can get a email when a MAR is locked, or when a record is noted that pill was missed, or that that med administration was refused. They can get a text message. They can get an SCOM message for any of those as well. So that's your default notification profile. You can set up multiple default profiles. I have to select at least one media, so one of these has to be a yes, so they can get an email anytime the MAR gets locked. All right, so that's been updated. You can set up lots and lots of default notification profiles, and then your users can go in and select a default notification profile, or they can configure their own profile if they want to get fancy about what they get notified of. In order for them to select that they want to be notified, you go back to the user list, You click on a user's name, and there is a button. Actually, I think I clicked on someone who was inactive, so let me find someone who is active. We'll click on Amanda, and Amanda in her personal details will have a little radio button down here, or a checkbox, to enable notifications. Now Amanda will be able to go onto her account, go into her settings. If I save this, she can go into her settings, and she can, you know, set that default notification profile, or she can configure her own settings as well, so that she gets the alerts that she wants to get as a nurse, or as a case manager, or as a you know, quality assurance person that wants to see when someone is deleting or doing something that I really want to be notified of. So a little bit of flexibility. I'd say use this conservatively at first until you're very comfortable and your level of staff who are using those notification profiles are familiar with how it's used and how they would be notified of that. Because if you get too many notifications, you're just kind of numb to it, and you really want to utilize it for the things that matter the most. Don't think there's any special information that you guys aren't already aware of with programs and sites. Same with the individual homepage. For one reason or another, we've selected different features of the system that you can choose to show up or not show up on the individual home. This is for your entire agency. So if you're just kind of introducing staff to certain concepts like allergies and diagnosis information showing up on an individual's profile on their individual homepage, you can check those off to have them show up. I think they'll already all show up when you are on the individual home. I'm not 100% certain. I may be wrong about that. But you can choose. Custom fields. As you guys are utilizing Therap and you're going further and further and realizing that there's certain things that you want to show up in individual data, you will create custom fields and have those questions show up in the individual data form. Our individual data form is going to be going through a transformation at some point in the near future where a lot of these questions and a lot of these details won't necessarily be part of that individual data form. They will be linked to it, to other modules about the individual demographics and stuff. But basic information about the person will always still be there. But for those questions that we don't address in our allergy form or in our shared contact form or on our individual data, you can create your own questions and have your staff or team answer them. So you pick what the question is. Does the person have a mobile phone? Yes or no? Or what's their mobile phone number? What's their email address? I think email's already been added to the individual data. You can select whether it's going to be something like long text or numeric, whether it's going to be a yes/no radio button, whether it's just a text box for a short answer, or a drop down with a list of options. And you can add those options just like you would with ISP programs. And then you can make this a requirement on the individual data to have that filled out. And you can also push this to the emergency data form if you wanted to print out on those EDFs as well. So a lot of customization, a lot of ability for you to create lots and lots of custom forms. I tell you this now while we are looking heavily at that individual data form and looking to try and get some of those custom fields on other forms where they really should be and populated on the individual data form as they should be. So that's data that we are macro data that we're looking at, not the individual data, but macro data of like what kinds of fields are people putting into the individual data form that Therap should be utilizing? What kind of questions are you guys wanting to have identified on this form that may be identified somewhere else and need to show up when you're looking at an individual's profile? So we keep very busy on our end looking at how to make things a little better. All right, a couple more things left to go. I know it looks like a lot of things on here, but we are going to not be addressing a lot of this stuff about specific modules like the personal finance module or the pharmacy interface. That would take up, 20 minutes on its own, just going through admin functionality for setting up pharmacies or service directories and so forth. But we do still have a few things on here that are specific that you don't really get covered in the generalized training. And I think GER event categories are one of those. I showed you guys in provider preferences that you have, those preferences of when a type of event is high or medium or abuse or neglect, who should be notified. Well, you can do your own set of what you consider high or medium or low, and not just depend on what Therap has determined is high or medium or low priority. So when you do this, this will be utilized in your general event reports. If you want the default rule that you saw on the provider preferences to show up, you have to remove these high notifications, medium notifications. You should have none of these manual entries added. So that's your color text at the top that tells you a little bit of instructions. To add these, very simply, choose the category, whether it's high or medium. You're not going to be able to force an issue for low-level notifications. So this is going to say, hey, for this particular type of event, you need to have it medium or higher. And then you choose the event type. And you'll notice those small, tiny asterisks only next to category and event. So for an event type like an injury or an other type of event or a death or a med error or whatever, you can say, hey, for other types of events, and then you can choose from the type of all those other types of events that show up in your incident reports. You know, if this is a hospitalization, it has to be medium, if not a high. And that is going to restrict your staff and not let them submit the incident report until they go back and change that notification level to medium or high. They can't get through, they can't turn it in, they're going to get a big error message and it's going to get blocked. So you can go in and kind of, you can also do the causes of, you know, if this is an injury or something, you can note the causes, the severity levels for an injury type, treatment by, you can note who needs to be treated and so forth. Or if there's any treatment by a nurse or a physician, then it's going to trigger that it be a medium or a high for those types of events. So a lot of customization that is fairly new. I think this just started to appear either early last year or late the year before when we did the changes to the GER. All right, we went through sign-up agreements. Your consent types, your letter types, your social histories, your document types, these are all to do with your, these three have to do with your individual histories as part of your Health Plus module. So for those of you that have an individual history and you're going through and adding consent and you're adding a history of what that person did in the past and maybe a foster home placement or a group living placement and stuff like that and building a history for that person, then you can use that individual history module. And let me just select somebody. I only have some generic client A and client B. But you can go in and add that social history or that family history or the medical history, and you can add to this drop-down list of types of things that show up. And for each one of these, then you have an ability to add a narrative, a begin date and end date, whatever you want, so you can build an ongoing narrative about the person prior to receiving services at your site, prior to their program enrollment history, or maybe inclusive of that. You know, there's other information that you want to include, hospitalizations and so forth. That all kind of builds into there. Individual document types and agency document types deal directly with document storage. You have certain types of documents that you want staff to be able to identify when they're uploading to document storage, or agency documents. These allow you to build them. Questionnaires and case notes, I think this is where we're kind of getting into the weeds of the actual modules. So these are case note based modules. If you enable business intelligence, you can assign different users specific dashboards so that they can look up those dashboards and get the alerts, get the running list of what happened when that dashboard data was recycled every night with the latest data as of early that morning. I don't know if there's anything in particular that you wouldn't understand already from stuff we talked about with archives and imports from Excel. All of this stuff for the individual care is either adjusting their ISP programs or their HAB services behavior plans. It's all module specific. Legacy IDF data is that old data before the switch, where you're able to see the changes with a person. If you're looking up an individual and you want to look up their archive data, then you can see, you know, kind of changes that took place. And let me see if I can go back 13 months with this one. The nice thing about looking up archive data like this, I can look up someone like Mary Nelson. She's been updated multiple times. Look up any one of these, and you should see a little highlighted field to see what was changed. And that is not in this. So that is not something that is happening on this archive data. It happens on archive data. It doesn't happen on the archived individuals comparing their IDFs. Other archives do have that feature enabled where you can look up individual data as it appeared before and after any particular changes. I'm not remembering which ones of those it is offhand. I apologize. I should have done a little more homework on that particular field. But I want to be cognizant of your guys' time. I think we've covered all of the generic admin stuff that you're not going to get covered in these module-specific trainings about billing or data-driven outcomes or scheduling or finance. I want to leave this open for a couple minutes. If anyone has any additional questions, I'd be happy to answer those. This will be posted within a couple of weeks. I will get back to you on that question about the admin roles as far as being in the report library and what's the name of that report that you need to request. So when this gets published, I'll make a note to myself to send an email out to the people who attended this so that you guys get a confirmation of what the name of that report is so that you can request it. All right, if you don't have any other questions, I'll stay on another minute, but I want to thank you guys. Have an incredible rest of your day. I hope this was helpful. If not so much for you, those of you that are expert admins, for some of your future admins who you're going to be onboarding and training in the years to come. Again, thank you and have a great rest of your afternoon.